A very good morning to everyone, distinguished representative from FAO, Dr. Justin Chisenga, Ms. Marilyn, our speaker today, Dr. Alessandro, ASEAN University Network, University Putra Malaysia, esteemed colleague, students and participants. A very good day to all of you. Well, it is my great pleasure to welcome everyone to this webinar on the FAO Technical Lecture Series, which is one of the activities under the FAO AUN-AFS Youth Research Proposal Competition 2026, which is a strategic initiative aimed at empowering the next generation of agri-food leaders in the Asian +3 region. Today's webinar is more than an informative session. It's actually a platform to inspire young researchers to think critically, propose innovative solutions, and contribute meaningful to the transformation of agri-food systems. Across Asia, agri-food systems are facing complex and interconnected challenges, including food security, climate change, environmental sustainability, nutrition, public health, and inclusive rural development. Well, addressing these challenges requires strong scientific evidence, practical innovation, and meaningful links between research and policy. And this competition reflects the strong partnership between FAO and AUN-AFS. For those who not know what is AUN-AFS, it's actually a new thematic established under ASEAN University Network. AFS stands for Agriculture and Food Security, which combining FAO's technical expertise and policy relevance with the academic strength and regional network of AUN-AFS. Well, through this collaboration, we aim to bridge the gap between academic research and real-world policy application. Ladies and gentlemen, the program provides an important opportunity for young graduate students to develop research proposals aligned with the FAO strategic framework, particularly the areas of better production, better nutrition, better environment, better life, and cross-cutting innovation through data and digital transformation. And these priority areas are highly relevant to the future of sustainable, resilient, and inclusive agri-food systems. And through the journey from proposal development, selection, mentorship, grant award, implementation, and policy dialogue, participants will gain not only research experience, but also exposure to regional collaboration and policy-oriented thinking. And this is especially important because young researchers are not only future leaders, you are also current contributors to the solution that our region urgently needs. And I would like to express my sincere appreciation to FAO, AUN-AFS, ASEAN University Network, University Putra Malaysia, and all partners involved in making this initiative possible. And I also warmly encourage all eligible students to take this opportunity seriously, to be bold in your ideas, and to ensure that your research contributes to practical and impactful solutions for society. With that, I wish everyone a productive and inspiring webinar. May today's section provide clarity, motivation, and direction for all potential applicants. And ladies and gentlemen, now allow me to briefly introduce with our speaker today, Dr. Alessandro Patriarchi. He's an AMR Regional Coordinator, FAO Regional Office for Asia and the Pacific that is based in Bangkok, Thailand. Dr. Alessandro Patriarchi holds a PhD in microbiology from University College Dublin, where he specialized in the ecology and molecular characterization of Campylobacter species in poultry. He has over 15 years of international experience with the United Nations system, including FAO and WHO. And he joined FAO's Animal Health Service in 2015, where he established the organization's first interdepartmental working group on antimicrobial resistance and coordinated the development of FAO's first MAR action plan. He also served as FAO's tripartite focal point, facilitating collaboration with WHO and WOAH. And after contributing to AMR capacity building initiative at WHO, he returned to FAO's Regional Office for Asia and the Pacific in 2025, where he leads regional efforts on AMR governance and food safety system. And ladies and gentlemen, after his presentation, we're going to take one or two questions or 2 to 3 questions if available. from the participant. And now, Dr. Alessandro, the platform is yours.
Thank you very much, Prof. Smara, and to all, very good morning or evening or afternoon. Here in Bangkok it's a morning, so good morning to all, and thanks so much for the introduction. I'm very pleased to be here with you, and hopefully my presentation will provide you with some inspiration as you move on with your careers. So I'm going to share screen now to present my few slides. Can you please confirm you can see my screen?
Yes.
Okay, excellent. So thanks again. Again, my name is Alessandro Patriarchi. I'm a microbiologist by background, and I'm currently serving at the FAO Regional Office for Asia and the Pacific as Regional AMR Coordinator. I'm very pleased to present to you a few slides covering the issues of antimicrobial resistance and how it pertains, of course, the One Health approach, and as well the RENOFARM initiatives. Before I go into the presentation, just very briefly, the FAO mandate is to achieve food security for all, improve nutrition, raise living standards, increase agricultural productivity, improve the condition of rural population, and contribute to a growing world economy while ensuring freedom from hunger. The regional office based here in Bangkok is one of the 5 regional offices, is committed to transmit and making the mandate reality here in this region, and it does organize its work around the strategic framework 2020-2031 and the FAO's 4 betters: the better production, better nutrition, better environment, better life. And these are guiding our work for a more efficient, inclusive, resilient, and sustainable agri-food systems. Amongst the priority that this office is addressing, antimicrobial resistance is one of them. It's one important priority. It is relevant to the FAO's mandate as it directly threatens food security, sustainable agri-food systems, animal and plant health, rural livelihoods, and safe food production, which are all core areas of the FAO's responsibilities and mandates. So by the end of this presentation, you will hopefully have a better understanding of what antimicrobial resistance is and why it matters to agri-food system and its transformation. You will hopefully become a bit more familiar with what are some of the tools that we are as FAO currently using, as well as framework and initiatives. And I hope you will formulate in your mind and identify opportunities and challenges for research and innovation as a direct result of hearing this presentation. So just very briefly, AMR can be described not as a disease, but rather a natural phenomenon that occurs when bacteria, but also viruses, fungi, and parasites evolve in such a way that they are no longer responding to antimicrobial agents, such as antibiotics, antivirals, antifungal, and antiparasitics. These are drugs who are meant to kill the organism that cause disease in humans, but also in animals and plants. So the AMR is making infections harder or impossible to treat and increasing the risk of disease spread, severe illness, disability, and ultimately death. The AMR gives the ability of microorganisms to resist antimicrobial treatments. It occurs naturally, but it is accelerated very much by misuse and overuse of these compounds And it affects, of course, humans, animals, plants, and environment all together. If we go back to the discovery of the first antibiotic, penicillin, by Alexander Fleming, we realize that, and I'm quoting, one of his saying is that he realized that it is not difficult to make microbes resistant to penicillin by exposing them to concentration not sufficient to kill them. So in a way, as Alexander Fleming discovered the very first antibiotic, he also outlined the basis of antimicrobial resistance by informing the world that it's very likely that these microbes will develop resistance to the same antimicrobials. Why is antimicrobial resistance important? And this slide is providing him some numbers, but it does make infection harder or impossible to treat. Imagine a simple cat you might have in your arm that get infected by bacteria, and you are no longer able to treat that infected wound. So the treatment that you will have to go through will become longer and more difficult, if not impossible, to treat. AMR causes millions of deaths each year globally, and there is constant estimation of numbers that's coming up at global level. Just in 2021, bacterial AMR alone directly caused an estimated 1.14 million humans deaths and was associated with 4.7 million deaths globally. Without any action, AMR could reduce the global life expectancy by 1.8 years within a decade and cause up to 39 million deaths by 2050. And the region, Asia and the Pacific, South Asia and the Pacific, is the region that is most affected by antimicrobial resistance. It threatens modern medicine. You have to think that antibiotics are used also when anyone needs to go through surgery or for cancer treatments. These treatments or surgery or other medical attention rely on the use of antibiotics very much. So if those antibiotics or antimicrobials become ineffective, then we are going to affect also the way we treat cancer and other conditions. It increases healthcare costs and the economic losses. We will see in a few slides, I'll show you some numbers around the economic losses, but it obviously increases the healthcare costs as patients will have to stay longer in the hospital as the treatment to treat their infection or disease are becoming less and less effective. It spreads across human, animals, and the environment, including plants. Again, I will show you in a couple of slides how the AMR is one of the areas that pertain to One Health or that requires a One Health approach. It is getting worse over time with deaths projected to rise. And AMR is not something we can defeat. It is something, however, that we can control and mitigate by applying the good practices, and we will provide some example as I go through the slides. And then finally, trade food safety and food security as well. So how is AMR related to the agri-food systems? That's simply because AMR threatens animal health, both terrestrial and aquatic. It threatens plant health, food security and food safety, the farmer livelihoods, and the environmental sustainability as a whole. The emergence and spread of resistant microorganisms is driven in part by the misuse and overuse of these antimicrobials in food production, livestock, aquaculture, and crop production, including crop production. Addressing AMR requires, therefore, a so-called One Health approach, which I am sure you are all familiar with, that promotes good production practices, biosecurity, disease prevention, surveillance, and the responsible use of antimicrobials, amongst others. So this slide is hopefully providing you with a clear understanding on why antimicrobial resistance has to be addressed using a One Health approach. On the left-hand side of this slide, you can see a picture with many red dots. These red dots represent antimicrobial resistance microorganisms, but also residues of antibiotics or plasmids, which are capable of transferring the resistance between bacteria. You can also see a lot of sectors are represented in here, starting from the human sectors, but also pet animals, pharmaceutical factories, intensive animal husbandry, wastewater, crop production, rivers. You can see waters, you can see the soil being contaminated by either bacteria that are resistant or residues or plasmids. So that's to describe it and to make it clear that antimicrobial resistance has no boundaries, it recognizes no sectors. Therefore, we need to work in a coordinated manner under the One Health approach to seriously address this issue. Again, a few more numbers in terms of human deaths that are attributed to bacterial AMR, this time focused in South Asia, estimated in 2021 to be 335,000 deaths, or 270,000 in South Asia, East Asia, and Oceania. Approximately 22% of countries in this region still report using antimicrobials for growth promotion. And this is a practice that sees the use of antimicrobials or antibiotics in very low dosage that is administered to animals so that their nutrient intake is higher. So in other words, low dosage of antibiotics affect the microbiota of animals so that they can grow faster with less nutrients. This is a very bad practice, and we as FAO are trying to support countries in phasing out completely this practice as it extensively contributes to the phenomenon of antimicrobial resistance. Many countries, again, still lack a comprehensive framework to address antimicrobial pollution in the environment. Think of the withdrawal periods when we treat animals at farm level. If we do not respect the withdrawal period, then some of these compounds of antibiotics are excreted in non-metabolized directly into the environment, in river or waters. And that's happening to up to 80% of these antibiotics being excreted in the environment, non-metabolized. So you can see how really AMR needs really a coordinated approach among sectors under the One Health umbrella. At the global level, but also regional and country level, FAO collaborates very closely with what we call the partners organization, the World Health Organization, WHO, WOHA, the World Health Organization for Animal Health, and the UNEP, the UN Environment Program, to support countries in addressing AMR under the One Health approach. Now, if we change our lens and we look at the issue from an economical perspective, the impact is huge. I think there have been a few reports, one very recent report from FAO that highlights, in a few words, highlights how vast the economic impacts in agriculture is due because of the issue of antimicrobial resistance. Without robust action, global treatment costs and productivity losses could reach up to 412 billion and 443 billion respectively for treatment and from productivity losses. The GDP loss in livestock production could reach up to 575 billion by 2050, with nearly 1 trillion in global welfare loss. So these are really, really high numbers, and it's really showing how the economy of especially low and middle income countries will be affected eventually if nothing is done to address antimicrobial resistance in agriculture. When it comes to the FAO, the Food and Agriculture Organization started addressing antimicrobial resistance in 2015, when the very first FAO action plan was drafted by the Interdepartmental Working Group on Antimicrobial Resistance that brings together different expertise and sectors that we have within our organization. And you can cluster the area of work that FAO is implementing from global, regional, and country level into 5 main areas. The first is pertaining to strengthening governance and allocating resources to accelerate and sustain progress at country level. And when you say governance, you think primarily on the mechanisms that are in place at country level that should guide activities and action to address antimicrobial resistance. Any multi-sectoral mechanism that guides their efforts would pertain to this area. So any support that we as FAO give the government to set up multi-sectorals truly One Health mechanism would pertain this area. Another area is increasing stakeholders' engagement and awareness. This is a very, very important, as the issue of AMR is not really easy to understand nor easy to explain. As I said earlier, AMR is not a disease. It's rather a phenomenon, and the general public might get confused on what it exactly implies, the antimicrobial resistance and how they are affected primarily by it. Another important aspect under the awareness and engagement is that awareness alone will not work. We have now some data showing us that if we try to raise awareness alone, that will not drive any change. And therefore, engagement, such as this series, engaging with youth and researchers, trying to communicate clearly what the risks of antimicrobial resistance are, it's very, very important. And that hopefully will drive behavioral change and ultimately a better use of these resources that we have that are life-saving. Another important area is the surveillance and research. It goes, I think, alone that countries and then generation of quality data, it's utmost importance if you want to drive policy change. You need to generate data and to generate around the patterns of antimicrobial resistance, but also not the way we use in a given context. How much we use and how we use these compounds. So that's why it's very, very important that countries are equipped with laboratories that are generating quality data that can be ultimately used to drive policy change. Enabling good practices to prevent infection and control, that's also a quite practical area of work. We will see some example for each of these areas in the next few slides, but this area pertain primarily on the way farmers who concern the food and agriculture uses these compounds, these antimicrobials in their farming settings. The promotion of responsible use to keep antimicrobials working is also an important area. They goes sometimes hands in hands with good practices. And so this area and all the effort the FAO and partners conduct to address AMR would ultimately ensure the efficacy of these life-saving antimicrobials. We want to preserve them while sustaining food and agricultural production. And on the other hand, we want to reduce the prevalence of antimicrobial resistance and the spreads and slow down the spread and emergence across the whole food chain. So on the left-hand side, you see a few picture of a couple of documents, the blue and the orange. Those are the FAO action plans, and the one above, the white one, is the very first global action plan on antimicrobial resistance, which was adopted by the World Health Organization back in 2016 to provide the blueprints or the global guides to address antimicrobial resistance. The first edition of the Global Action Plan is now outdated, and the second edition has just came up. Last May, the World Health Assembly has adopted, and governing body from the WOHA also endorsed it, and FAO and UNEP will follow with the official endorsement of this document, which was co-developed by the world and by the quadripartite, so-called quadripartite organization, therefore FAO, WHO, WOHA, and UNEP. And this document encompasses what I've just discussed. It's completely in line with the areas that I was just mentioning. And it's, of course, described the importance and highlight and underscore the importance of the One Health approach as the only way to address antimicrobial resistance. So in it, I've just extracted what I think are important points. And the first one is the One Health implementation and recognizing the interconnected roles of human, animal, plant, food, and environmental sectors. The second refers to the importance of the prevention-first approaches. That includes the importance of biosecurity, of vaccination practices, infection prevention and control measures, water and sanitation, and improved farm management practices. A sustainable agri-food system that reduces the need for antimicrobials rather than relying solely on the stewardship measures. This is a quite important point as we are shifting a little bit our narrative from we need to use less antimicrobials to we need less antimicrobials. So it's just a one word difference, but it changes a lot in terms of how we see things ultimately taking place country level and what concern, for example, the farming practices. Stronger surveillance and monitoring systems for AMR and AMU. We will see what FAO and the quadripartite organization came up with in terms of systems to compile quality data to drive change in policies. Sustainable financing and accountability. This is something that is becoming increasingly important in the past few years. As we see that many national action plans lacks the costing and the finance component, leading to plans that are not receiving any funds for them to be implemented. So it's something that it comes with the cost benefits analysis, and it links nicely with the engagement and awareness raising. So that we can use a different type of communication. This time will involve the economy of farms, for example. And the final one is the international cooperation, innovation, and knowledge sharing to accelerate implementation. Again, this refers to the One Health and to the need to coordinate and cooperate with existing partners to address the AMR as one. What I've just described in the global action plans nicely linked to what we call the RENOFARM. This is the reduce the need for antimicrobials on farms for sustainable agri-food system transformation initiatives. This is a flagship FAO global initiative on antimicrobial resistance that was officially launched in April 2024. And as a 10-year initiative, it helps countries reduce the need for antimicrobials in agri-food systems while maintaining or even improving the productivity. The reason it is linked to the Global Action Plan is that because the new Global Action Plans makes many reference to RENOFARM initiatives as it reduces the dependence of antimicrobials through increased biosecurity, vaccination, and improved husbandry practices, by strengthening the surveillance system and the laboratory capacity, by developing an implementation of costed plans, and by promoting a One Health governance and multi-sectoral coordination. The RENOFARM initiatives will inform very much two areas of good practice and responsible use of antimicrobials that I was showing you earlier. Again, RENOFARM, it's a 2 years young initiative, launched in 2024. Just last April this year, the second symposium took place in Rongsheng, China, where 300 to 400 participants from government, research institution, producers, organization, private sectors, and international partners gathered together to assess the achievement and progress against RENOFARMs globally, and also to show renewed commitments to the principle of the RENOFARM initiative. And this commitment has been sort of signed in what we call now the RENOFARM Rongsheng consensus document that highlights commitments from all participants to accelerate the development and financing of national RENOFARM roadmaps, to integrate the 5G's approach into routine livestock extension practices. I will tell you what the 5G's approach is in a second. To prioritize the prevention first policies and to strengthen evidence-based decision-making. As RENOFARM is a global initiative, but it has very, very concrete targets, and these are three. The first one is to ensure that at least 100 countries with their national action plans are fully implemented in their agri-food sectors. The second is that at least 50% of animal plant health workers strengthen their capacity to reduce the need for antimicrobials in agri-food systems. So this is a lot about trainings and raising capacity of those individuals who can make the change at farm level. And at least 80% of countries that participate in the in-farm initiative contribute to the international FAO monitoring system, the so-called in-farm. And I will spend a couple of slides on what the in-farm is in minutes. But the 5Gs refers to good production practices, good health services, good alternatives, good incentives, and good connection. This is the way the RENOFARM initiatives intend to go and to achieve the three targets by using these 5Gs. And it uses also 5 action accelerator, including education and awareness, youth engagement, public and private partnership, behavioral and social intervention, research, innovation, and new technologies. So altogether, the 5Gs with their action accelerators are going to drive change and transform agri-food systems in a way that it will not rely so much on antimicrobials no longer, but it will improve what are the good production, good health service, good alternatives, good incentives, and good connections. This slide is just showing you just a screenshot of each of the 5Gs and the related domains. And then this just to show you that there's some certain level of complexity behind the 5Gs, and without me reading through all of this, I think one of the interesting one is the good incentives, as it pertains what we call the certification or farms accreditation process. That sits mainly under the good incentive pillar of the 5Gs. And this is designed as a progressive risk-based system to encourage sustainable reduction of antimicrobial use while improving farm management standards. This recognition or accreditation process will ultimately drive change in the way farms are managed for the better, of course, by following a scoring system through which farms will be able to hopefully receive some accreditation or certification by the governments of the countries where they are in, and that will hopefully lead to better access to markets and therefore better livelihood for farmers and companies that run the farms. So this is just to provide you an example on how the RENOFARM initiatives touches the ground from being a global level initiative to a very, very practical action at country level, at farm level. Zooming in now at the regional level, here at the FAO RAP office, we follow the same approach, of course, as outlined in the Global Action Plan and the FAO Action Plan, which includes and embed the RENOFARM initiatives. But we need to apply a few points or a rather lens to ensure the action and implementation take place in this so diverse region as the Asia and the Pacific. So we need to understand upfront what are the organizational, technical, political, and social cultural contexts that we have in this region and at country level. We need to develop and apply existing tool and frameworks to address the identified gap, the provision of training and support to build needed capacity in food and agriculture, facilitation of coordination and partnership that can reinforce effective mitigation of AMR in food and agriculture, and then enable sustained implementation. These are, in a nutshell, it can give you an idea on how this regional office is actually trying to make a difference in this region when it comes to addressing antimicrobial resistance. From now on, I would like to just provide you a few examples of what are the tool or framework or the initiatives that we as FAO regional office are using at country level primarily to address AMR under each of the areas that I was mentioning you before, which are governance, awareness and engagement, surveillance, and then good practice and responsible use. The government's area, as I said, it pertains primarily supports provided to countries in implementing, but also reviewing and developing of national action plan on antimicrobial resistance. The awareness component, it's more around the stakeholder engagement and making sure that the behavioral change take place. And the surveillance, it's all around generating quality data that can be ultimately used to drive policy change. And finally, good practice and responsible use to enable that change at farm level by using for example, the 5Gs that I was just mentioning under the RENOFARM initiatives. So for each of these areas, I pulled out a couple of one or two examples. Starting with the strengthening sustainable governance and resource allocation to minimize and contain AMR sustainability in food and agriculture. These slides represent how national action plans supports might take place. First, the National Action Plan, it's a guiding document, national document, which compile all the activities or implementation steps that the government will then implement to address an issue, in this case, antimicrobial resistance. And since antimicrobial resistance, we have seen it's a multi-sectoral phenomenon. It deserves what we call the One Health approach, and therefore the governance and the bodies at national level who will develop and implement national action plan must be multi-sectoral in its nature. In other words, governments should have in place mechanisms that are including expertise around animal health, terrestrial and aquatic and food sectors, the environment, the plant sectors, etc. The mechanism, the national body will then develop or update the activities within the national action plan. And then this national action plan will have to be costed by using and we can support the government by using a dedicated costing and budgeting tool to then provide a monitoring and evaluation framework and then implement and ensuring that the implementation is monitored to assess what's working and what's not working. A concrete example, Mongolia is not part of ASEAN, but I think we can also mention Cambodia as one of the latest, where these countries were developing or have developed national action plan on antimicrobial resistance, but they were lacking a costed plan or in some cases even a monitoring and evaluation framework. So our support as FAO regional office was to help them developing a result-based and fully costed One Health national action plan by strengthening capacity in how to develop a monitoring and evaluation framework, costing and budgeting by teaching them how to use a dedicated tool, and then multi-sectoral coordination by increasing awareness and engagement of the all the sectors which are relevant, including human health, animal health, agriculture and plant protection, food safety, water sector, and environment sectors for the case of Mongolia. Very similar case study was support was provided to Cambodia as well and other countries in this region. Moving on to the awareness and engagement area, we primarily ensure that the issue of antimicrobial resistance is explained and the awareness levels around the globe and at country level, but even at community level, it's always up. Trying to make sure that farmers, individuals from the general public, the private sector, civil society are constantly kept updated on what AMR is and what it means for their own lives. As I mentioned, and as a gap or a challenge here when it comes to awareness, is that, again, awareness alone will not drive change. You know, even to make things more difficult, AMR is quite complex to describe. And so it is likely that by using a technical language, you will not get attention from the general public. So the opportunity here would be to come up with different language or different narratives according to the target audience we want to engage with. So if we are focusing on farmers and we want to drive change in the way the farmers conduct their business at farm level, then we might want to use, for example, the economic lens and change the narrative around the economic lens with the understanding that farmers, the major income is from their farms, from their animals, so their interest is to keep animal healthy and productive, and so forth for other categories. For what concerns the good practice and responsible use, This is mainly driven by the RENOFARM initiative. Again, this is a 10 years action oriented. It's country focused, country-led initiative responding to the global agri-food system transformation agenda. It is basically saying that we cannot continue business as usual when it comes to agri-food system and the way we conduct farming, because the production and the economic loss will be so much higher in the upcoming years, according to numerous estimations, that we must transform the way we are conducting the agri-food system. So RENOFARMs once again engage the entire production chain from farm to fork, trying to strengthen partnership, including public and private sector, with a simple objective to support countries in reducing the need for antimicrobials through the 5Gs again that I mentioned earlier. Indonesia was amongst the first countries who piloted the initiatives back in 2024. It focused on the poultry sector in the Lampung province. It supported the implementation of national action plan by promoting farm-level practices that reduce the need of antimicrobials while maintaining the productivities of animal health. One of the concrete activities that we have implemented in Indonesia to achieve the goal of RENOFARM is through the so-called farmer field schools, which is a model that is focused on the awareness, so increasing the awareness of farmers, increasing the capacity for farmers to apply biosecurity measures, increase the good husbandry practices, increase the responsible antimicrobial use, and the peer-to-peer farmer learning. This has been proven to be quite effective, and it's something that we are actively engaging with different countries in the region to conduct and to drive change at farm level. So 20 facilitators were trained, farmer field school was established. That means that the activity is sustainable as it continued, led by the government themselves after we provided the initial support. It has improved the biosecurity and the disease prevention, and it has reduced the reliance on antimicrobials to better farm management. So it was an important case study in Indonesia, as it showed that this approach works at country level. Moving on in strengthening surveillance, research, and evidence through multi-sectoral surveillance and research on AMR, AMU, and residues. This is one of the tools that we are currently using as FAO globally. It's called the Assessment Tool for Laboratories and AMR Surveillance Systems. This is a tool that serves to allows countries to measure the status or stage of their national AMR surveillance system in food and agriculture, and also their capacity in terms of laboratory capacity to generate quality data using a standardized approach. It is quite an important tool if you want to ensure that countries raise their level and their ability to generate quality data that will then eventually drive policy change. One of the latest missions we've conducted in Malaysia in September 2025 evaluated the strengths and the gap in the governance systems, in the laboratory work networks, and data management, surveillance coordination to support evidence-based improvements in Malaysia's AMR monitoring system. The mission has shown and provided the country with a very well-structured roadmap for strengthening the surveillance and the laboratory capacity, and ultimately helping national authority to prioritize investments, so therefore saving funds, and improve cross-sectoral coordination to enhance and generate reliable AMR data for policy and decision-making. Think of the usual situation in a given country is, in terms of surveillance, is that different laboratories, maybe in different sectors, they independently and work in clusters maybe looking at the prevalence of antimicrobial resistance. This is not very effective way of working. It would rather be more meaningful and less expensive to coordinate into a network of laboratories to improve the way we utilize resources in a given country. So that's what the ATLAS mission and the ATLAS tool allows countries to identify and hopefully implement. Another example is the International FAO Antimicrobial Resistance Monitoring, so-called INFARM. This is a global information system that has been developed by FAO to support national, regional, and global surveillance and monitoring. The system will help countries to collate and analyze AMR and AMU data, to visualize and interpret data to inform policy-making decisions, and to share this information at national and international level. The INFARM systems comes as a clear request from a gap that was identified by the quadripartite and other partners, consultation with other partners a few years ago now, whereby we realized that the global, regional, and national level, we were not having data around how we use antimicrobials at farm level, and what are the patterns of antimicrobial resistance amongst these food and agriculture sectors. So therefore, INFARM was generated together with the WHO's Global Antimicrobial Resistance and Use Surveillance System called GLASS, which focuses on the human health, and the World Animals Antimicrobial Use Global Database called ANIMUSE. Together, these global systems will contribute to what's called the GISA. It's the Quadripartite Global Integrated Systems for Surveillance and Antimicrobial Resistance and Antimicrobial Usage. This GISA system will ultimately give the world a much detailed picture on how the world is using these antimicrobials and how we can prevent and retrieve and maintain the effectiveness of these antimicrobials over time. So it's quite an important area of work that is, of course, coming with large cost as well for countries. This is an example on how this office has actually organized a regional training to train some focal point at country level in Cambodia, Indonesia, Laos, VDR, Malaysia, Philippines, Singapore, Thailand, and Vietnam to strengthen the readiness for AMR data reporting, which is taking place on a regular basis. I think the third call for data will soon be announced and would ask countries, relevant bodies to share quality data around the surveillance and resistance and use. Finally, this is my last slide. It includes a few takeaways that I hope will stimulate some discussion and questions. The first one is that antimicrobial resistance is a growing threat to food system, livelihood, and public health. We are not resolving the AMR phenomena, but we can indeed control it and mitigate it and ensure that agri-food systems are more productive. The One Health is not an option. It is the way we have to address antimicrobial resistance at all levels, at global, regional, and country level. Better data leads to better decision. We have seen how the INFARM and other systems allows countries to raise their capacity in terms of generating data for us to better use and drive decisions. FAO and the quadripartite partners provides quite a few number of tools, knowledge, and policy supports that can be used by countries to implement the prioritized activities. Countries need to move from planning to implementation. how to do it. This is one question that we are still addressing, and it's not an easy one, as we have seen in the past 10 years that countries do develop national plans, including all relevant areas under the One Health approach, but the implementation of these activities still remains quite slow. So what it is that is preventing countries to implement? Is it the lack of funds? Is it the lack of resources? Is it the lack of political commitments? Is it all of them? And what can we do to address this? And finally, prevention reduce the need of antimicrobials. This is widely been addressed by the flagship initiative, RENOFARM. We need to move from the idea that we can cure and treat any disease, whether it's human, animal, or plants, because this will no longer be the case. We have to start understanding that these antimicrobials, they are not, they start to not working anymore. So we need to move from the treatment to the prevention of diseases. Okay, with that, I hope I wasn't too over time, but I'm very happy to take a few questions. Over.
Thank you very much, Dr. Alessandro, for your valuable inputs and sharing on the topics of One Health to all of us this morning. And yeah, now I would like to invite participants, if any of you would like to ask a question. But before that, in the chat room, I have one question from Abdullah from Pakistan. His question is regarding the in-farm RENOFARM initiative. How is FAO addressing the standardization of farm level surveillance data from LMICs where veterinary reporting is highly fragmented? Yeah, you can check at the chat room.
Yeah, you want me to address this?
Yes, if you can answer, yeah, respond to that question. Yeah.
Well, thank you. It's quite a relevant question, and I'm pleased to address it. The existence of protocols to generate data is there, and the in-farm, for example, the in-farm systems provides countries with that information, with those protocols, which ensure that data is generated using standardized protocols, which are accepted by and defined by an extensive consultation process by experts around the globe. We by doing so, countries are able to again use this standardized data to generate again quality data that can be compared over countries and over time. However, the challenge remains here, as I was saying, the use of standardized protocol, which are currently available in the in-farm, and I believe I have a link in my presentation on the in-farm, where you can look at those protocols. The real challenge is the implementation. It's how can we make sure that government or national entities do apply those standardized protocols, which might be different from what the countries have been used up until then. To finish my answer, it's while protocol exists, you always need to contextualize the feasibility of those protocols and compare it against the current capacity that a given country has. Not all the countries have capacity to conduct LMIC. Not all countries have the capacity to grow Campylobacter. Not all the countries have the same capacity. So where there is no capacity, primary action is to raise that capacity so that then countries can adopt and use the same standardized approach. I hope that answered the question.
Okay, thank you very much, Dr. Alessandro. Now, if any of the youth research proposal competition participant, if you like to ask any question to our panelists today, you can unmute yourself and then straight away asking the question you like to ask. Any question from the participant? Okay. Probably there's another subsequent question from Mr. Abdullah. I think just a short one. What are the immediate plans by FAO to leverage spatial mapping and data modeling to transition in farm from a retrospective repository into an active early warning system that can predict emerging resistant hotspot?
Yeah, again, a very, very, very nice, relevant question. Thank you. Thank you for that. So I think my answer would have to include the GISA system. So as you might remember, the GISA system is the global integrated surveillance system that would enable anyone to really analyze data in such a way that it would become clear on what are the partners, where are we going in terms of the use of antimicrobials and antimicrobial patterns. So that will enable us to identify what are the risks and put in place active early warning systems that can visualize, hopefully in a very simple and detailed way, because the assumption is that quality data is generated using standardized protocol that would enable a visualization of patterns across countries and across regions. And I recall at the beginning of the presentation, I mentioned that AMR does not recognize any borders or sectors. It doesn't recognize countries. So we can no longer focus on one country or one region. Maybe a region would be okay, but we can no longer think of generating data in one country and then the next country, if we have a gap or limited data, that would impede us to generate a clear message that we ultimately want. Finally, to answer the efforts that we are putting as quadripartite in terms of generating this kind of evidence is huge and massive. You have to think that these 4 organizations that compose the quadripartite are quite big organization, and what we are doing is huge in terms of coming up with systems which are making some sense between each other, that align with each other, even though they are different sectors. So it is a huge work in terms of coordination between the organization and between sectors in general to address that. Thank you. Over.
Thank you very much, Dr. Alessandro. We now we are receiving lots of questions, but anyway, I might allow another 2 questions because we run out of time. But probably if any of you have any additional question, you can email to us. So probably we will provide the answer for you in the future. And there's one question from Cambodia, Dr. Alessandro from Panajam. His question is, many promising probiotic technologies have shown success in laboratory studies, but their adoption by fish farmers remains limited. From FAO perspective, what are major barriers to translating probiotic-based innovation into practical disease prevention strategies for small-scale aquaculture farmers in Asia? Yeah, I think because even in Malaysia, many farmers they innovate their own, probiotic or postbiotic whatever. But since that is actually the feed additive whatsoever, sometimes they have to go through a lengthy process in order for the products to be accepted worldwide. So your comment on that?
Yeah, and thanks, Fanjan, for the excellent question. I think what I'm seeing as I'm reading through the question, I see a common line that's highlighting once again the gap, and that is the implementation. So we might have, we might be able as globally to generate enough evidence to demonstrate that, for example, use of probiotic technology are successful in a laboratory setting. But even that, I would argue that we have evidence that the use of probiotics and other alternatives that are not antimicrobials are successful at farm level. We have demonstrated that. What we are missing is that it's farmer doing it, then somehow farmers might still think that the use of antimicrobials definitely is cheaper option. Hence, they might believe that by using antimicrobials, they might save money, therefore their livelihood will be improved, the health of animals will be maintained, but doing so, they are contributing vastly to these major threats, which will ultimately affect us as humans, but also animals, the productivities, and the environment. So here I would put the emphasis of my answer will be to the awareness and engagement area, and to the fact that I was mentioning before. We need to identify who are the target audience for our awareness raising messaging. If it's a farmer, then we might use an economic investment case that demonstrates to them that by using less antimicrobials and raising biosecurity or using probiotics, it's actually effectively increasing their production, maintaining their production or increasing it, and saving funds and money and financials for them in, say, 5 years, as opposite to maintain the same business as usual. To complete my answer, I think in all the areas, governance, surveillance, good production, responsible use, that I was showing, we have quite a lot of evidence on what is the good thing to do, let's say. We have that. I think in over 10 years, we have generated enough evidence. The issue is now on why countries or stakeholders are not implementing those. Why are they still, for example, some countries are still using antimicrobials as growth promoters? We need to understand that, and we need to provide those countries with enough tools and guidance for them to move away from these bad practices, using all we have already developed. Thank you, Oren.
Thank you for the answer. Probably just I think this is the last question from the participant. Saiful from Indonesia. He's asking how to integrate the RENOFARM into biosecurity frameworks in national level. Yeah.
So the biosecurity heavily rely on the 5Gs that I was mentioning in my presentation. Those 5Gs are including different domains. Each of the 5Gs includes different domains. Those are, you can see them as opportunities for farmers or for health workers to utilize for the better. So how to integrate the RENOFARM into biosecurity framework at national level? It's completely down to the government. And again, I'm making a lot of links back to the awareness. You increase awareness on how RENOFARM initiatives and the 5Gs are going to be beneficial for the farmer, for the agri-food system transformation, but ultimately for the human beings, the productivity, etc. We do have evidence. It's just compiling evidence and transforming that into understandable language for farmers that needs to then apply the biosecurity framework in their farms. Over.
Thank you very much, Dr. Alessandro, and thank you also to all participants that actively participate by asking a question. With that, I believe all of us has already received valuable inputs again from Dr. Alessandro, and has been presented in the chat box. If there is any additional question, you can send through email to us at aun_agri.foodsecurity@upm.edu.my. With that, on behalf of AUN-AFS and also the FAO, we would like to thank to all of you for participating to this webinar. Please get close to us, because there is a series of technical lectures by FAO officers that going to be organized within these few days. So keep updated, keep check your email, and before we end our session, if you can take a group photo, that would be great. Miss Pim. Okay, thank you very much, everybody. Thanks, Dr. Alessandro, and to all of us, to all of you. Have a good day. Bye-bye.